Welcome back to TV5 News at 9. Joining us this morning is Congressman Dan Kildee and Jim Milanowski from Genesee Health Plan. Thank you both for joining us today.
Thank you. Yes, thank you.
Congressman Kildee, I want to ask you the first question today. Why is it important for people to have health care coverage?
Well, for one, it gets them the care they need when they need it, and it erases the uncertainty and the anxiety that people have about getting sick without proper coverage. You can never plan for an accident or for an illness. You can't predict when it's going to happen. And so what we encourage people to do is plan ahead and get health insurance, get covered. And of course, one of the reasons we want to make sure we're explaining this is that it's much more affordable than people think it might be. There are ways that their premiums can be dramatically cut. So if they're curious about whether they can afford health care, they really ought to check it out. And that's what we really want people to do.
And Jim, I know that the process of getting health care coverage can be intimidating for folks. What is available right now, and is open enrollment over?
So open enrollment into the affordable health care, Obamacare, whatever you want to call it, is through January 15th. So, about 8 or 9 days left of that. And so I agree, David. Sometimes it's very confusing. It's confusing for me to try to explain health care. We have trained staff at the Genesee Health Plan, and then we have community partners that can help people enroll into health care, answer their questions. Really, the message should be there should not be anybody, whether it's an adult, a child, that does not have health care coverage. And now is the time to really work on that. As Congressman Kildee said, there has been some definite changes, and it has made a lot of this coverage more affordable. So someone who might have done this a few years ago and just said, I don't want to have health care coverage anymore, it's too expensive. We are seeing some significant savings to people, and so they should at least check it out and not go without health care coverage.
And Congressman Kildee, I want to talk to you a little bit more about that, the changes that people will see this year. I know that there were some changes with the Build Back Better plan. Talk about those changes.
So the big change came from the American Rescue Plan, which passed Congress, was signed by the president in his law. And that did a couple of things. Number one, we extended the deadline for enrollment to January 15, as Jim said, so people still have time to get enrolled. We also increased the direct support for those premiums that people pay when they purchase their health care on the exchange. We increased the amount of money that the federal government provides. Technically, it comes in the form of a tax credit, but that tax credit applies directly to your premium when you sign up for health care. And what it means is the average Michigan family saves about $800 a year. And with these changes, 65,000 Michigan families will benefit from those improvements. And somebody out there might be one of those families. And in fact, the support is so robust that in some cases people are able to get no-cost health care because the insurance support, the premium support, which is calculated based on their income, is sufficient to cover the entirety of the premium. But Jim said it, I just want to reiterate it. If people think they might qualify, or even if they're not sure, call Genesee Health Plan. Talk to one of those experts. They'll walk you through it. There's no obligation when you call. You don't have to sign up for anything, but you can get your questions answered. And they don't talk to you, the way a bureaucrat talks to you. They talk to you and explain it just like you want it explained to you, in simple terms, so that you can understand it and make a good decision for your family.
And Jim, you were nodding your head the whole time that Congressman Kildee was talking about the Genesee Health Plan. So let's talk about some of the resources and the ways that Genesee Health Plan will help people that are intimidated by this process, or who need health care, or they just don't know what to do.
Well, I couldn't have agreed. I couldn't even said it better. So I'll have to give Congressman Kildee some money after this. But he did a great job explaining. But we can help somebody in a number of different ways. We have people can just call us 810-232-7740. Talk to one of our enrollment specialists over the phone. We also can have that person interact with our staff person virtually. A lot of people now are comfortable with that technology, and we can help somebody virtually. You can see our staff virtually face to face, and we can go over, we can share our screen to show what we're seeing on the computer and really break it down for somebody, or they can call us and schedule an appointment and do that face to face if the technology is not there. You could also go on HealthCare.Gov and do it yourself. I would certainly, if you think you can do that, that's fine, but we could certainly be available to answer any questions that you might have, or we could certainly finalize that process if need be.
So the resources are there, so please utilize them. Gentlemen, thank you both.
Absolutely. Yes.
Thank you both for joining us today.
Thank you very much.
Thank you.
And you can find more information in the hot link section of WNEM.com.